Welcome to Healthcare Quality and Risk Matters, the show where we dive into the topics that matter most in healthcare quality and risk management. Wondering about patient safety, quality improvement, or risk mitigation, but weren't sure who to ask or were afraid to ask? Well, you're in the right place. We create a safe and judgment-free space to explore these critical topics together that will leave you informed and inspired to make a positive impact on healthcare and patient outcomes. So let's learn and grow together because healthcare matters.
Good afternoon, everyone, and welcome to this October edition of Healthcare Quality and Risk Matters. My name is Gary Bierc. I am the CEO of Aperitisoft Healthcare, and I am being shadowed by my two esteemed colleagues. I don't know how your cameras look out there, but to my left, when I'm looking at the screen, I've got Rob Santamoor, who is our Chief Operating Officer. He is a registered nurse and knows just about everything there is to know about healthcare quality. And also right below me there is Dr. Timothy Brown, who is a resident expert on healthcare administration. And we're excited to be here with you today because we're going to be talking about the cost of quality and how it affects your hospital. There are some staggering numbers, folks, that we're going to be talking about today. We're going to be a little bit different. We're going to be a little bit academic today, diving into how quality affects the cost of a hospital. But I think it's going to be worth hanging on and staying with us. Look, if you're out there, please go ahead and hit the chat. Tell us where you're from, that you're participating today. Feel free to throw in comments, questions along the way. We'll try to tackle all those things in our half hour. Our format begins by us talking about the incident of the month. Rob, what do we got for this month?
Hi, good afternoon. So I pulled an article from the American Hospital Association written this last May where they were talking about the staggering costs of there's healthcare right now. The article goes on to share there's hospitals continue to struggle with rising costs, drugs and supplies, we know that. But the insurers are not keeping up with that cost and how they're increasing the reimbursements, nor is CMS. So in 2023, hospitals faced major underpayments, particularly in some of the complex services like behavioral health, burn care, say. Behavioral health was up 34%. There's from what the costs rose to. There's in burn care, there's reimbursements were 43% below the costs. So every patient costing that hospital money, there's coming in. They can't even recoup the cost. The healthcare sector overall is just feeling the impact of the workforce struggles. There's shortages, whether that be people or supplies like drug shortages. You're seeing in the news every day. But the new annual average median cost for a drug is $300,000 now. The median cost. That's insane, right? So the American Hospital Association is working with legislation like Congress. There's trying to figure out a way to manage this. And that's a long road. But those are the highlights from the article itself. And although I see the need, there's to work towards legislation. Quality now is important.
Wow.
Yep. The costs are just crazy. And
yeah, you gotta have to sit back and let that sink in, don't you, Timmy?
That was a wow moment. Absolutely, Rob.
Yeah.
I could dig in really far to these costs and just whether it be staff or drugs or you name it, right? And it's just insane to think that hospitals need to run it as a business, but we can't have a return on each patient that we see. So how are we supposed to keep our doors open to continue to serve these communities?
That is a great question.
Well, I'm just trying to wrap my head around the fact that quality is the defense against these bleeding costs.
Mm-hmm.
And if hospitals are not deploying the right things they need to, not only is inflation hitting them hard and the lack of staff to meet the need, now they're bleeding out the side of the ship, so to speak, and they can't stay afloat. I mean, how are we going to grow and improve as a healthcare system in the United States or around the world, for that matter, if we're not hitting on all pistons? And one of those pistons has to be quality.
Absolutely.
And Gary, to that point that you just mentioned, with healthcare organizations not being able to keep up, we're starting to see healthcare systems close at a rapid pace, unfortunately, which
And
means
that's
that
frightening,
patients,
Timothy. That's frightening.
Patients are now having to go further to get the medical care that they need. And it's really sad for these communities that have their hospitals that are shutting down. I mean, it's worse to see, of course, a food desert, but then you think about a healthcare desert on top of that, it can really be devastating for someone that needs quality care within reach.
Well, and payers aren't even so providers and hospitals aren't even able to stay in contract with payers right now. There's letters are going out all over the country every day to private citizens. There's where they're being notified that their provider is no longer a part of Blue Cross Blue Shield or Aetna or United or whatever their insurance company is, right? They're getting these notices that their care is no longer going to be covered and they have to find a new provider because providers are having to bail. There's on the insurance, there's contracts, right? They're going to say, I'm sorry, I can't take any, there's Anthem, say, patients because I don't make enough in reimbursement to continue to see those patients. It costs me too much money. I'll have to close my doors for everybody. So they're having to make these really hard decisions. But to your point, Gary, we need to tackle this problem in two ways, right?
Okay.
We need to decrease the cost of doing business through quality improvement and work toward there's higher reimbursement rates that are in keeping with there's our current state of our economy, right? And it's not easy to manage your quality system. There's without a way to figure out what your baseline is. So we actually even created a quick tool, if I can show that really quick.
Yeah, that might be a great way for our audience to see how you can connect the dots from what quality is focusing on and how it's affecting the bottom line of the hospital.
So for those of you that are listening audio only, I'm going to describe this very quickly. For those of you that have this up on your screen, you can see that it's a calculator that assesses the overall efficiency of your processes. There's what you're paying out and things like fines and penalties. There's as well as staff turnover rates. There's your KPIs where you are in target for patient volumes. There's and then service lines, right? We're discontinuing service lines at every hospital, whether that be provider level, or whether that be entire like acute or ambulatory service lines. There's formulas built into this that actually show there's the impact on revenue. There's all you have to do is enter your main revenue. And it will show you how much you're losing. There's in your inefficiencies and overall cost of poor quality. Anybody that wants to use this tool, we'll absolutely collaborate with you. So if you reach out to Timothy, drop your name, there's in the chat. We can connect with you so that we can help you plug this in. We would love it if every organization was able to calculate this number to bring back to their executive team to start building really solid quality programming, right? That's our goal. We want you to have a better quality program. There's to keep your doors open, to keep your facility running, and hopefully not have to send out so many letters with services that you can no longer provide.
That's a big number. So you're giving an example there of a $1 billion revenue hospital. And where would you say the quality, the way that you answered this calculator here, is this somebody middle of the road? Is this somebody that's very poor in quality? Where would you roughly put them?
So this is middle of the road. Which is, I think, scarier because this is not a hospital that would be performing poorly from either an inside or outside perspective. It would be a hospital that is keeping its head moderately above the surface of the water.
So if I'm reading this correctly, what we're saying is that out of $1 billion that is coming in the door, 153 million dollars is going out the door because of poor quality.
For the middle of the road performance, yes.
That's a huge number.
And that's the middle of the road. Wow.
And think of, right, your staff turnover rate. So this example, right, we rated it a 5% staff turnover rate. Any of our listeners on the line know that the hospital you're working with, I would bet there's a 99% chance that your turnover rate is significantly higher than 5%.
Yeah.
And we know that the cost of a new person is 90% more per hour than it is for somebody who's been doing it for 10 years or greater, right? So staff turnover has a massive impact on your cost of quality, patient outcomes, all downstream quality initiatives. Thinking through, there's what this would mean to the organization, $153 million. What that would mean to that organization is crazy.
And we're talking annual dollars.
Annual, yeah. And knowing
that Timothy, a CEO looking at that, what do they normally equate quality to? I mean, there's several line items there. What are they normally looking at and missing the boat?
That is a very interesting question. I just put a question in the chat kind of along those same lines. What I wanted to mention to that particular stat that Rob just put up is poor quality costs real dollars at the end of the day. I know we're talking about $1 billion organization, but if you're thinking somewhere around 10 to 12% of that overall income is going out the door for what we would consider preventable things. In my mind as a CEO, I'm thinking we have to do better. And there's small tweaks that can definitely be taking place to reduce these overall errors. Things like documentation error or handoffs between departments or failure to maybe follow standardized care protocols, hand washing. These are small things that can be taken care of easily on the back end that can save, as you can see, hundreds of millions of dollars on the front end for a $1 billion organization. Think now, smaller hospital systems, we're talking about a few $1 million that's going out the door that could be reallocated towards better patient care, better training for your employees, or even paying higher salaries for your current employees that you have. So think about that on the back end. They're real problems that are real issues that impact real life across the board for your organization.
I think what CEOs or the C-suite of a hospital is what they lack or fail to do, I should say, is they connect the dot that I can see my fines and penalties. That's a direct impact or lawsuits to poor quality. And they're looking at those numbers. What they don't realize is that staff turnover and revenue reimbursement rates and things of this nature are also playing a part in the impact on the organization due to poor quality. So it's a much broader problem than just looking at a few data points. And
that revenue reimbursement rate too is it's so heavily impacted by quality. And I have had straight up disagreements with CEOs over my decade doing this, right? It's all contract, it's all business, it's all political, right? That's all I hear. But our negotiation power as a hospital, when there's amazing patient outcomes, low readmission rates, low risk to the insurer, we have a significantly higher argument for higher reimbursement rates. On top of that, we have all of our value-based contracting that goes along with all of those. There's insurers, right? There's CMS does value-based contracting, right? It's based on a performance, how much you retain versus how much you have to give back or how much you can argue for a bump in reimbursement. And a 1% on a hospital that bills $1 billion is a huge number when you're billing an additional 1%. And you can earn that through improved quality programming. it is imperative that CEOs start to understand the impact that quality has on the financial health of the organization.
And I'm going to say CEOs and the entire executive board team, because we know that those decisions are really made in a conglomerate group. There's a group of people that are making these decisions. So there needs to be a consensus on how much of an impact quality does make on your organization. It can't just fall onto one person. It needs to be an understanding across the entire executive board.
Agreed.
Mm-hmm.
Well, why don't we run into the minute matters and let's let that all sink in, and let's think of some questions we might want to fire out there. Rob, if we have access to some questions from the audience, we can kind of weave them in as well. And let's move into minute matters.
Sure. So, Gary, if I could, sorry, I saw both of you getting ready to ask a question, but if you don't mind, there's, so me as the quality leader, there's what could I put on your desk to help you as the CEO, right? Pretending that you don't work in healthcare quality. There's what could I put on your desk? There's to prove to you that the cost of quality is just as important as meeting with your legislators.
I mean, all CEOs are going to think alike, right? They have pain, and people are bringing pain to them constantly. You know, we're being impacted by this problem, that problem, that problem. Often this is a mistake of the CEO desk. The squeaky wheels get grease when maybe that's not where the grease needs to go. That's a common risk problem. But the first thing that I think quality needs to do is to understand what are the initiatives or focuses that the C-suite is looking at as they're going through this general pain of economic times that we're faced with, and then be able to bring forward the quality, the calculator, whatever, to be able to demonstrate, you know, hey, boss, I think I can make an impact on where we're bleeding by us ramping up our quality initiatives here, here, and here. And this is how much I'm going to be able to bring to the table, savings-wise, revenue reimbursement-wise, if we take these initiatives. It always has to be that financial discussion. And I know in healthcare, it's a problem. People never want to equate things down to the dollars and cents, but that's what keeps the doors open.
It does.
Right.
It does.
And we're not trying to be insensitive. What we're trying to say is that greater patient outcomes means financial benefit. Mm-hmm. And, you know, the quality team needs to bring that argument forward using ledgers and spreadsheets that are easy to follow. I've been telling people for years that CEOs, you got to present things to them in crayons. You can, too many line items. They're, you know, you've already lost them, right?
That's true.
Right. It's got to be in big bold letters. You know, this plus this plus this equals. Look at that benefit. They're going to ask you for the details, and then you can say, I've got them. But you've got to get them right to the point right away with those big numbers. And the calculator that you've come up with, Rob, is a good starting point. You know, to bring those things forward with what is necessary. Looks like we have a question from Jasmine.
Yes. So Dr. Brown asked a great question to our audience. What are some common overlooked areas where poor quality tends to manifest in healthcare? And I loved this answer. Because these are so often overlooked. And when we built our calculator, there's to help all of you on the line. We will provide you a white paper for each point. So that you can speak to your leaders, right? Like we want you to take our information and use it to build your hospital better. These are areas that we took into account too, and it's so true. Your hospital satisfaction scores, huge impact on pay for performance, value-based contracting with CMS, reimbursement rates, there's penalties, there's high staff turnover. We just discussed that with a 90% increase overall per hour. There's, if not more, right? Because that is based on pre-COVID numbers. And I do find that to be important because the nursing school that I went to, is a different setup, the way that we were taught clinically to start to practice in the healthcare setting in real time, right? There's side by side with patients, side by side with experienced nurses. And I had 3 preceptors. None of them had less than 20 years experience.
Wow.
There's now, if you had, I mean, one of my preceptors had 40 years experience. I'll never forget her.
Mm-hmm.
There's it, but that doesn't exist anymore, right? So those numbers are going to be different as new data comes out, and we're going to find that there's our cost of quality with staff turnover is significantly higher because you have people that have been doing it for 6 months acting as preceptors.
Mm-hmm.
And I cannot imagine precepting somebody being a nurse for 6 months. That is not a tenured nurse.
No.
Yeah.
Jasmine, thank you so much for that great answer and giving us some things to talk about here, because it's good stuff.
Absolutely.
Did I answer your question, Rob?
You did, and you did it wonderfully.
Can I jump in? I want to add one thing to what Gary said that I love that comes to the executive team. The executive team don't just want your problems that you have when it comes to quality. Bring solutions, and I think Rob has hit the nail on the head with this, because we have those white papers that you can share. What solutions, what ideas do you have? A few podcasts back, I believe Rob used the statement, "Be loud." We want you to be loud. What solutions can you bring to your organization to make the transition a little bit smoother, to reduce the overall quality issues that you have in your overall departments, or if you're in a part of a multi facility unit, your hospital, your area? What can you do to improve in yours, and then use that to kind of repeat or share throughout the entire organization, and standardize those processes and things that to help to reduce the overall quality issues that you may be having. I think sharing that information to your executive team gets them to move a little bit quicker, because I think often we think we bring it to the executive team and they're just this all-knowing, all-powerful group that makes these decisions. But a lot of times they're waiting on you as leaders to step up and bring those solutions, and they're going to stand behind you to kind of solidify and back you. So if you bring those solutions to the executive team, a lot of times you'll have the support that you need to make the changes quicker.
But make your business case. Make your business
case. You have to make it.
Tell them this is the solution, what you're solving, and here's how much it's going to benefit financially the hospital. I mean, a lot of people leave out that last part. It can't just be what feels good, particularly when the hospital is going through a tailspin, often with things that are outside their control. And, they're looking for any way they can to keep the boat afloat, so to speak.
So this is a question for both of you. So my challenge, especially post-COVID, there's to convince leaders that even when I have that information in front of them, right, I have the return on investment, to convince them that it is worth, there's paying up front, there's some FTE time, some software time, right, implementing technology. There's process development time. I keep hearing we don't have the time, that's too hard. That's not where our priority is. We can't even progress our patients. And I fully understand that. As a nurse, I empathize, right? You're thinking tunnel vision. How do I treat patient 1, patient 2, and patient 3? That's all I'm focused on. And that's what we're spending our time on. How do I get them to understand that even when the numbers are very black and white, that it is still worth the effort to do it? Sorry, I feel like that was a hard question.
No, I think it's an honest question, I believe, Rob, and it's what many leaders face. It's like, okay, I know that these changes need to be taken care of, but however, we may not have the upfront cost, so we may not be able to make that investment. And one thing that I've heard going through several different courses when it comes down to understanding healthcare is you have to be able to invest in your low-hanging fruit first. So if I can just take an example of that, is leaders can really prioritize their overall quality improvement efforts with clear ROI potential. And that's like things like reducing your readmission rates or streamlining discharge processes. This really is something that they'll see a quick turnaround and measurable turnaround that will kind of build momentum across the board for them to start to build out a better plan. I think if we can get those early wins, it builds motivation for others to say, okay, something's working, something's changing. Let's all try to kick in on that overall effort. We all know that short staffness is one of the things that healthcare is facing right now. However, if we can build better processes to ensure that those that are working longer hours have more breaks, they have additional assistance with each other, maybe cross training across the board. It can make those hours seem a lot less until we can get more staff in and build out a better staffing process for others. So that's just small things that I think of when I hear about we don't have the upfront costs, but what can we do? There are smaller things that can be done to get low hanging fruit to build motivation for bigger initiatives for the
Good point.
organization.
Very good point.
I like that. So taking that, like we showed last week, kind of that pyramid approach. Where
Mhm.
can we help you get those wins at where you are now?
Correct.
I like that.
I mean,
That's good
it's going to
information.
look like a mountain or an elephant when you look at
Correct.
all of these things, particularly after looking at a calculator like yours.
Mhm.
Start somewhere, right? Start somewhere and get that low hanging fruit, as Timothy was talking about. Do it in bite sizes. Start
Right.
showing some value. The more value you're bringing back, the more management's open to hearing your next solution idea.
So true.
I like
Right.
that. I have been told that I don't like to crawl, walk, run. I like to just sprint. And so that is good advice. And I do know a lot of my other colleagues, especially in quality, they are looking for the ability sometimes, right, to check a box and say, yes, I've done this. This is done. This is compliant. I'm happy. There's why can't the service lines just fix this? There's why can't we implement this technology? Why can't we just, right? And I hear that all the time. Why can't we just do it? It makes sense. It's logical.
Mhm.
We need to figure out a way, like you're saying, to make it digestible for everybody. With where they are. And this may be a good starting point because if you use like our calculator, right, you can see where some of your highest costs are. You can see that your high costs are in staff turnover. So let's start focusing some programming around that.
Yeah.
Let's capture the quality data
Mhm.
around why people are leaving, right? Let's send out some surveys. And get some real feedback, and then let's take action on those, right? I know most places do a survey at exit, but are we really taking action? And then what are we doing for our current employees?
That's
How
great.
are we retaining them?
So, Rob, do we have any other questions from the audience as we're getting close to the end of our half hour?
And wow, that went really fast.
It sure did.
So
A good conversation though.
it looks like we addressed all of the questions organically through our conversation. And so if anybody has any of the last minute questions that is listening to our live show, please drop them in. If you're not listening to our live show, and there's YouTube or LinkedIn after the fact, please still drop your question in and we will get back to you.
Respond.
Yeah. Timothy, let's give you the last word. And I'm gonna give you a question, the final question. We've been talking about all year long, we've been talking about disparate systems and system issues in quality that are often the obstacle to breaking into these key cost of poor quality issues. How can somebody out there take on an initiative in a bite-sized approach, as we're talking about, to start solving this systems issue? What would you recommend to them?
I would definitely recommend a data-driven quality management system. And you have to look at it from this perspective.
Yes.
Improving the cost of quality in healthcare requires a really comprehensive quality system that's designed to address the unique challenges of the overall industry. Like I said, adopting that overall data-driven quality management system allows your organization to really prioritize that real-time data collection and analysis for your organization. Having that information in hand allows you to make the decisions that need to be made, which is what we talked about earlier about being dangerous or not necessarily dangerous, but having the data to be able to prove your overall case. Beyond that, I would recommend they implement standard care protocols, having something to help you know what the right process is when things go wrong. So instead of being that reactive for your organization, you already have those protocols in place. You can start to build out a proactive approach for your overall quality management organization. Then you want to engage and train your workforce. We look at our current employees as our most valuable entities for the organization, of course. Then you also look at your future employees coming in. You want to have a basis of for your future and new employees that are coming to the organization. So you train your main staff. get them set up to where you need to move forward so that when new staff come in, they already know what the new protocols are and they can follow suit. I would integrate continuous improvement processes. So, as you said, Gary, baby steps, small chunks. What are we currently doing? Where do we want to go? What's the in between, and how do we get there? And that's how you build that overall process. Where we currently are, looking for the vision of where we want to go, and then we build those steps to get there. I take everything ABC, when it comes down to trying to improve the overall process
Yeah.
of quality. Last thing I would say is leverage technology. You have these systems available. Aperitisoft has a wonderful system that allows you to be able to see that real-time data. It's a great way to kind of look at what's currently going on. We can pull it up and show you where you currently are at day one of your organization. And then once you start to build that plan within the system, it's very simple to work through each of those individual incidences to improve your overall quality. And then last but not least, I would foster leadership accountability and support. We have to hold our leadership teams, our executive teams accountable and support them as well with the data that you're going to be able to pull from the overall quality management system. So that's how I would kind of work through the overall process to improve quality for a healthcare organization.
Outstanding. Outstanding. Is this a comment, question?
It was just a comment that aligned really well with Dr. Brown's. There's commentary at the end, so I wanted to drop it up there. There's to show there's a camaraderie across the quality, risk, and compliance healthcare world. So we appreciate your support.
Yeah, thank you very much.
Thanks.
Well, we are out of time, gentlemen. We want to thank our audience for participating again this month. Before we say goodbye, Rob, what is the topic for next month?
Next month is long-term health. Long-term healthcare. So we're very excited. We're going to have a guest on.
Okay.
Monica is going to be joining us. As our subject matter expert on long-term care. And that will be
the owner and executive director of a long-term care facility in Florida, correct?
Absolutely.
Yeah, I understand that Monica and her contingency management plan worked out very well since they were a direct hit from the hurricane, Milton.
Correct.
Yes.
The thing went like clockwork. So, yeah, she's going to be a great guest, I think.
Definitely going to be able to speak to a system of great quality.
Yeah.
Yes.
Yeah.
Awesome.
So, all right. So, folks, thanks for joining us. Please like our stuff everywhere, and give us comments, give us questions. We'll get back to you as soon as we can. We appreciate your support, and we look forward to seeing you next time. Until then,
Awesome. Take care.
Bye-bye. As they say.